We have come a long way with MARPI customization. We've had our fair share of failures over the 2 decades that we've been working with a MARPI appliance, and we're excited to let you know about some of the new advances that are coming to the world of skeletal expansion for non-growing patients. So today, the things we do differently are 3-dimensional treatment planning. Today, we integrate the 3D X-ray with an intraoral scan for complete customization and complete custom appliance design for every patient. Some of the examples in terms of the creativity that we can incorporate into the appliances today: we are able to intrude, we're able to protract, and we're able to take on some very challenging malocclusions and often avoid maxillomandibular surgery. The length of the mini screw is very important, as well as the location of the mini screw placement for increased predictability. So today we do all of our design work with a digital workflow, merging the DICOM file with the STL file. We have many variables that we can alter, including the length and location of the mini screw, the number of the mini screws, the placement of the jack screw, as well as the type of jack screw. You can see the variety of appliances today, and each comes with advantages, but ultimately the workflow in our practice today, we are predominantly working with a tiger screw and a 3D printed chromium cobalt custom appliance design. We can decide on the placement of the mini screw based on the patient's anatomy, and we can design it to avoid vital structures while engaging the greatest amount of bone. This dramatically increases our predictability, and we're able to deliver results that we are proud of. You can see the design workflow with our technicians deciding on the band placement, the framework design, as well as the position of the TADs. We're able to create a map for our surgeon, so the surgeon knows exactly where the TADs are being placed, as well as the length of each TAD. So you can see some of the before and after results that we're seeing very predictably today. Here you can see after the framework has been trimmed back, and we're able to finish the case with clear aligners. You can see the dramatic changes in the nasal floor, and the patients truly feel the difference in terms of nose breathing. We see dramatic changes with tongue position, of course with a wider smile, healthy gingiva, healthy bite. And we can help with patients that have issues like UARS and even sleep apnea. So you can see lack of tongue space in this adult female. We're able to expand and protract using clear aligners, and we're able to close that open bite. And she's provided with a great deal of relief as well. So really tackling some challenging malocclusions with custom MARPIs and clear aligners. We are also able to change our surgical techniques. We do less invasive surgeries today. This is an example of dome. And so we have this adult male, and he was diagnosed with sleep apnea, is maxillary deficient, and after wearing an oral sleep appliance, he can no longer get his back teeth together. So in this case, we're going to use a custom MARPI, dome incisions, and maxillary protraction. The case is treated with clear aligners. Here he is at 6 weeks. Dramatic opening at the level of the jack screw, and a huge difference in terms of his palatal anatomy. And so you can see before, after the surgery, and then as he's continuing to heal, we see a wider nasal floor, improved tongue space, and terrific occlusion as well, because the teeth are now hitting top to bottom in the correct position. Here is the same patient before and after, and he feels better. He did a follow-up sleep study, and he no longer has apnea. It's incredibly exciting to be part of the orthodontic community today, and the things that we're able to accomplish with MARPIs and 3D planning is fundamentally changing what we can offer to our patients. If you're interested in learning more, please visit us at inspiredortho.com. Thank you.